Hello, homies, and a very warm welcome to Homeopathy Hangout. Today, we get to hang out with Dr. Jamie Oskin in Arizona. Welcome to the show, Jamie.
Thank you. I'm glad to be here.
It's great to have you on. I'm always looking out for new content for our listeners, new courses, just because I'm so passionate about learning myself. So I'm always trying to see what summits are out there, what new conferences are out there, what information can we get out to our listeners. And somehow on my Facebook feed, I didn't even know how it happened. The 2024 Collaborative Homeopathic Conference came up. And then I was like, oh, what's going on here? And then I was looking up you as well. I'm like, oh, wow, Jamie's done amazing stuff. I have to get him on the show. So, yeah, welcome. It's lovely to have you here. Can you tell our listeners a little bit about your background and how you came to homeopathy?
My overall background, I had some health issues when I was a teenager. I had broken my leg and gained a lot of weight, and I was dissatisfied with conventional medicine, ended up making my way to naturopathic medical school. In the US, we have schools. I think they also have them in Australia, but naturopathic medical schools that are four-year medical schools. Anyhow, homeopathy is part of the curriculum there. And to be honest, I thought it was a little funny. It seemed a little odd to me. But when I was in my third and fourth years, I think in my third year, I had a homeopathy materia medica class. And at the time, I was experiencing a lot of rib pain, something called a costochondritis. And I went up to the lecturer after and I said, this has been bothering me and I haven't been able to get any help for it. Do you think homeopathy could help? And he said, yeah, sure. Come into the student clinic. And I came in and he gave me belladonna because the nature of the pain was like very sudden. It would start suddenly and stop suddenly and really intense pain. And it just magically went away. And I thought, wow, that was pretty interesting. There must be something to this. And so I began studying more and more homeopathy and requesting to be on all the clinical rotations for homeopathy in the naturopathic school. And I would actually sit in on extra shifts. So that was like when my love affair with homeopathy started. I got bit by the bug. And then when I saw it working well with patients, I became quite passionate about it. And so then I did general family practice residency, naturopathic residency, and then I did an extra 1 year residency with my mentor, Stephen Messer, at what's now Sonoran University. It used to be Southwest College of Naturopathic Medicine, but it's at least in North America, the only postgraduate residency program specific to homeopathy. And they've had, I think, about 13 to 15 graduates go through that program. And so I was fortunate to be the second resident to go through that program. And that was, I don't know, 15, 16 years ago. Time kind of flies. And so here we are. And then since that time, I've done a lot of teaching. Have taught courses for Whole Health Now online. I've taught at numerous Joint American Homeopathic Conferences, Summit, all sorts of kind of places. And I currently have a private practice. I'm located in Phoenix, Arizona, but I have a telehealth practice focusing in the homeopathic treatment of children with developmental disorders, particularly autism, pandas, tic disorders, speech delays, etc. So that's my main area, but that's like how it all started.
That's such a beautiful area to work in as well. I tend to work mostly in that sort of area too. And it's so beautiful when you can help those families. I have two super healthy children and they're hard work sometimes. And I just think if you have a child with developmental issues, oh, it's so hard. Like something as simple as for us just going on a holiday. They can't just pack up their bags and go on a holiday. It's just not possible for so many of them. So when you're doing work in that field, I think that's really beautiful. I was going to ask you about the residency that you did because we don't have that in Australia. We don't have the medical, obviously we do anatomy and physiology, but we don't study alongside the medical doctors like they do in South Africa and a few other countries as well. So what does that residency look like? What does that involve? And is it actually like a hospital type facility where patients would come in, or what does it look like?
It's a good question. It's not in the hospital. It's an outpatient facility. The Sonoran University, which used to be Southwest College of Naturopathic Medicine, is the naturopathic medical school, and they have their own medical clinic there. Now, as part of the residency, I got to work do some rotations with conventional doctors, like an oncologist and a cardiologist and an orthopedic surgeon. So I got to see more pathology in some other areas, but I did a rotation in developmental pediatrics, hence my love of helping children with developmental delays, but mostly it's an outpatient clinic. And the residency for many years was funded by a very generous donation by the Standard Homeopathic, who was owned by Highlands. And that funding phased out, and they have a new donor. I'm not teaching at the school right now, so I apologize. I don't know all the details about the current financial situation there, but they have a new donor. And so currently they have one resident per year who helps in the homeopathy department. And so we would have roles, multiple roles. We did a lot of teaching and help with curriculum in the classroom, teaching didactic curriculum, but we also worked in the clinic. So we like underlings on the attending physicians' homeopathic rotations. And then we grew into having our own clinical teaching rotations, which I taught at the school for 9 years. So eventually I had my own clinical teaching rotations where we would see patients and I would oversee students in the medical center there, and we would teach homeopathy. So it was really a great experience. At some point I left academia. Maybe someday I'll go back, but at one point I just left and ended up going into private practice. And so that's where I am right now.
Wow, that sounds really interesting. It would be so fascinating working alongside medical doctors as well and just bouncing ideas off them. But today we are going to talk about the 2024 Collaborative Homeopathic Conference in September. Can you tell our listeners why collaborative and how did this come about?
Yeah, it's interesting. I'm the immediate past president of the HANP, which is the Homeopathic Academy of Naturopathic Physicians, and we're one of the groups that's co-collaborators. And I'm the current vice president of the organization. So one of my volunteer hats this year was to sign up to participate in this collaborative conference. And I would say over the last several years, there's been pressure from the FDA with homeopathic medicines in the United States. And then there was a lot of, I don't know what the right word is to say, but tension during COVID. And so one of the beauties about times of stress is that it tends to be unifying. And what happened over the last several years is we've had a unification of the homeopathic community in North America, where several organizations that were in separate silos, not communicating with each other, not working together, have begun to cross-pollinate more and work together. And this year is the first year we're doing this kind of collaborative conference. And so the idea was that we would take all of the organizations for licensed medical professionals. The AIH is primarily an organization for medical doctors and DOs, and also naturopathic doctors, but primarily licensed physicians. The HAMP is the organization for the naturopathic doctors in North America. And then we have the Homeopathic Veterinary Association, or the Academy of Veterinary Homeopathy for the veterinarians, and the HNA, which is the Homeopathic Nurses Association. So we all collaborated and we formed a committee about a year and a half ago, and we just started brainstorming. And so I've had a seat at the table to volunteer with a really great group of volunteers. And there were some really exciting things kind of converging. That's the right word, converging at the same time. So one of those is that in 2019, George Dimitriadis, who's one of my mentors, he's like the world's English-speaking scholar on the Burning House and Therapeutic Pocketbook. And he's Australian. In 2019, he was here in the United States speaking at the Joint American Homeopathic Conference. Now, I've been studying the Burning House and Therapeutic Pocketbook method with George Dimitriadis since maybe 2013. So when he came in person, it was a really exciting time because I got to see my mentor in person. And when I got to the conference, he handed me a hard drive. And it looked, in fact, this is the hard drive right here. I just pulled it out of my desk. You see a small hard drive. And it had about 500 gigabytes of data on this hard drive. And what it was 20 years of hard work of George's. What he had done was he had been working on the repertory, and after the repertory, he started editing the Materia Medica, particularly Hahnemann's Materia Medica. And he was collecting the hard drive. In the hard drive, it's all the data he collected, but it started the old-fashioned way. Before Google Books, he would fly places like Germany and go to the Robert Bosch Institute and scan painlessly all these old books and make PDFs. And gradually, as Google Books came online, especially certain libraries in the United States, like the University of Michigan, et cetera, had large homeopathic libraries. And so he was able to collect more and more data, and he has thousands of documents on there, lots of homeopathic journals, but also lots of information from the old school literature. So in this hard drive, he has collected over 90% of the toxicologic reports that were cited by Hahnemann in the primary text homeopathic materia medica. So when Hahnemann was doing his experiments, he didn't just start with provings. He actually knew a lot about toxicology because of all his work translating, et cetera. And what he would do is he would cite substance effects to the old school literature. George Dimitriadis had spent 20 years collecting this. Now it's all like freely available on the internet, but I've done some of this work looking for like a Digitalis report or a Conium toxicology report to learn more about the substance effects. And I've banged my head against the wall for up to 2 hours searching Google trying to find something. If there's a spelling error or something, it can be really hard to find some of these documents. And the beauty of it is George put it all together in one place. Now, what happened is then the pandemic hit. And so he gave this hard drive to me as a gift to the HANP to make available to the profession. But when the pandemic hit, everybody's priorities, everything went on hold, and it took quite a while to figure out what to do with this hard drive. So if we fast forward about a year and a half or 2 years ago, I collaborated with a good friend of mine, Dr. Elizabeth Rice. She is the current faculty member in the homeopathy department at Sonoran University, department chair, and she's a good friend of mine. She was the resident who graduated the year after me. So I said, listen, Dr. Rice, we have this amazing tool, but it's not doing any good collecting dust in my desk. We have to make this available to the profession. So thanks to Betsy's hard work, she got a grant to basically house this library fully open source online at Sonoran University. And it went live on Hahnemann's birthday this year on April 10th. And so at the conference, we're going to have an opportunity to teach people how to use it. So this was a really long-winded preamble to basically say a lot of ideas were converging all at the same time. We had this library gifted to us that just went live, and we had this collaborative group forming of different organizations saying, hey, let's do a conference together. And I just happened to be on the group. And so I proposed to the group this idea. I said, all this is happening all at once. And my true heart's desire is that this library of really critical literature becomes used widely in the profession. And if nobody knows where it is or how to use it, it will be for nothing. So what we did is we started to put together the idea to put together a collaborative conference. So the collaborative conference, basically, the concept is it's a cohesive conference from soup to nuts. Every speaker carefully selected. The speakers all are very cohesive. The theme of the conference is returning to our roots, utilizing primary homeopathy sources to apply Hahnemann's methodology for consistently exceptional clinical outcomes. And what we're going to do in the conference is we're going to take people through step by step how to utilize primary sources. So how do you read Hahnemann? How do you look at his footnotes? How do you understand these crazy listings of symptoms? How do you look at his citations? And then take you into the library to find these things. And we're going to have exercises that we do. And let me tell you, I don't know if you've ever done this work, but it's beautiful work, because if you read a toxicology report of arsenicum or conium or digitalis or hyoscyamus or belladonna, the remedy comes to life in a way that it doesn't when you're just reading lists of symptoms in the materia medica, because you see, unfortunately, the poisoning effects, but what is a story unfold. And in the listing of proving symptoms, all you have is a list of symptoms. Symptom 1, 2, 3, 4, 580, it goes on. But when you see it happen in a real story, it makes an impression on the mind that you can't forget. So we're going to teach people how you read Hahnemann, how you access his citations, how you look them up in our library, how you study them, and then the application to the repertory. And the repertory that we're going to most focus on is the Berningshausen Therapeutic Pocketbook. And you may ask why. So the Berningshausen Therapeutic Pocketbook is a small book. It's a pocketbook. It only has 125 remedies, primarily the remedies of Hahnemann, 95 from Hahnemann, 30 from Hahnemann's pupils like Staff, Gross, etc. But they are the best proven remedies. And because Berningshausen developed the original repertory, the data in that pocketbook is the most accurate of all the repertories. And that repertory is constructed differently than other repertories, which that's a whole nother story. But I think I've been talking for a while, so I'll let you ask any follow-up questions. And if you want me to go into more on the Berningshausen Therapeutic Pocketbook, I can. But
I was quite happy for you to keep going. It's fascinating. And I was just going to look if my Bonninghusen is here or at the clinic, but I think it's at the clinic. And I'm so glad you said about the library, because I read about that on your website. And I was going to ask you about this grant and about the digital online library. Something I'm really excited about with this conference is that it's such a solid theme. So people are going to, I like the idea of walking in there and you're going to be shown the whole A to Z, and you can walk away and you can start using that straight away. So you don't then have to go and do other things. You're going to get everything right there that you need to be able to use Bonninghausen confidently. But maybe just keep going where you were going about why Bonninghausen, because my question would be, it's such a different time than 200 years ago when Bonninghausen was around. So is Bonninghausen still effective? And with 125 remedies, can we still do what we need to do in these crazy times?
yes, first, let me just say that one of the cool things about this conference, not only are all the speakers coherent, they're all cohesive, I should say, in using a similar methodology and returning to our roots, which Berningshausen was really Hahnemann. So it's Hahnemann's method that we're focused on, and returning to that original model of Hahnemann. And we will have lots of clinical applications. So even though there is what could be perceived as a scholarly aspect of this, a library, stuffy information, our aim is clinical effectiveness. So helping people use these tools so you get better results with patients. And so we're going to do lots of clinical cases during the conference. And then on the last day of the conference, which, by the way, the conference is also available virtual, so people internationally, you can watch the recordings if you can't attend live.
That was my next question.
Or you could attend live, but it might be in the middle of the night for you.
Yeah.
But on the last day, we're going to have 3 hours blocked off just as a workshop for active learning exercises. So one of the beautiful things I learned in my residency and having the opportunity to teach in a school for 9 years is that people don't learn just from lecture. They have to do things. And so we are creating a workshop where we will have exercises looking up citations in the library, exercises doing cases and practicing using the repertory. And as long as there's no technological glitches, everyone who attends the conference is going to be given a 1-month free pass to use the Berningshausen Therapeutic Pocketbook, 2nd edition, edited by George Dimitriadis, as an online repertory, so that you can actually practice the skills and do the case exercises in our workshop. So it's going to be a conference unlike anything I've ever seen, and I've been to a lot of homeopathy conferences. So that was a little aside. So let's go to the idea of why Berningshausen. So, Berningshausen's original repertories were structured like Kent's repertory, and he was the original guy. He came up with rubrics, and the organization of the repertory was like that. And Hahnemann wrote to him 3 times and said, hey, I'm paraphrasing, but hey, can you combine the books into one book? Because he had a repertory for antipsoric remedies and a repertory for non-antipsoric remedies. And Hahnemann's meta message was, even though I made this kind of theoretical separation of chronic remedies and acute remedies, in the real world, you could use nux vomica in an acute case or a chronic case. Whenever it's indicated by similarity, that's all that matters. The only law is the law of similars. There's no other laws in homeopathy. And so it's an artificial division, and he wanted the books combined into one. Berningshausen really struggled with this, and he was working on it for quite a while, and he got halfway through the book, and it was so overwieldy and so big, he decided he had to figure out a different way. And so he figured out a way to rearrange the information into different bits of data, and thus was born the Pocketbook. And it really is a pocketbook. It's small. If you have Kent's Repertory or Synthesis, they're big books. Like it sit on your reference, and without a computer, it's unusable. But the Pocketbook, this is the Demetriadis second edition. It has 2,250 rubrics, I think, about. You could read it before bed and learn some rubrics, and in a week you'd be done. It might put you to sleep, but you could learn the repertory that way. And what Berningshausen did, the genius of what he did was a model that Hahnemann had done, which is basically an idea of abstracting characteristics and recombining them. And the most beautiful example of this, I'm going to teach actually in my lecture during the conference, but Hahnemann writes in the preamble to Materia Medica Pura some sample cases. And what he does in those sample cases is he teaches you, although sometimes it's hard to decode because Hahnemann writes in this old-fashioned language, but what he teaches you is if in a proving there was a modality on one proving symptom, you could abstract that modality from that location and apply it to another anatomical location as long as there was no, what he called a contraindication. As long as at the new location you reattached the modality, the opposite modality didn't occur. So that's called abstraction and recombination. So what Berningshausen did is he broke up the bits of data and put them into categories so that the bits of data could be recombined, both in the original way that the original proving symptoms were, or in new novel clinical situations that had never occurred before. We think about this all the time. We don't understand often as beginners, we don't know how the tools were constructed. So you think that bryonia is worse for motion as this grand characteristic of bryonia, but it was maybe only a handful of proving symptoms that were worse for motion or better from pressure. We have, by making it a general of the remedy, we've learned that we can apply that modality to lots of different symptoms for bryonia. Does that make sense?
Yeah, I'm glad you're going into that a little bit more because we do have a lot of students as well. We have some home prescribers that listen, and we have some expert homeopaths and some new students. And so if you go a little bit more into what you mean by that, I know this is going to be really valuable and people are going to get it if you can get us some examples. But bryonia is an excellent example because, and Rustox, where the modalities are so strong, most of us will know what you mean by that.
Yes. So for example, in another type of repertory, like Kent's Repertory, which Kent's Repertory is really just an expanded version of Berningshausen's original repertory before he rearranged the information for the Pocketbook. So people, sometimes they think they're really different. Actually, Kent just copied mostly and added to Berningshausen. We have the evidence for that. But what he did by abstracting and allowing recombination of characteristics is you could mix and match data points. And as long as it's a characteristic of that remedy, that characteristic is a characteristic as a characteristic. And we do this all the time in medical diagnostics. In fact, that's where Hahnemann got the idea. In medical diagnostics, you have all the characteristics to give a diagnosis, but no one patient has that exact pattern, right? People have, you could have a diagnosis of strep throat, and one patient will present one way, another patient will present another way. And as long as they have enough characteristics that match the diagnosis, you get the label and it's called strep throat, right? Hahnemann took that idea from medical diagnostics and applied it to remedy matching. And so in the same way, a nux vomica case is a nux vomica case is a nux vomica case, even if it's a novel grouping of characteristics that have never been seen before. But as long as the characteristics are consistent for nux vomica, that are the characteristic symptoms in the case, it will always be a nux vomica case. So let me give you an example, because this touches on a point you asked me a question about. Is the Pocketbook still relevant? And I would say that after using it almost exclusively for over a decade, it's more relevant than ever. Okay? And physiology doesn't change much. Coffee was a stimulant in Hahnemann's time and is still a stimulant now. Belladonna dilated the pupils in Hahnemann's time, and atropine still dilates the pupils now. Our physiology has not changed that much in 200 years. Substances and their effects have stayed pretty consistent as well. In fact, even if you look at digitalis and withering, he and some others, Penkoville, some others who describe certain effects of digitalis, bradycardia, xanthopsia, which is yellowness of the vision, those things have been reported in modern cardiology journals as side effects of the drug digoxin, with no reference to Hahnemann or the old school people that Hahnemann cited, even though Hahnemann cited those things 200 years ago. So those effects on physiology are very consistent. Now, Hahnemann was probably the best pharmacologist of all time. He understood what we call drug pharmacodynamics, meaning like the dose response curve of drugs, 100 years, maybe 150 years before modern pharmacology, before what we call T half-lives and Michaelis-Menten equations. He was a pioneer way before his time, and he understood this better than anyone. And there hasn't been any homeopaths who followed Hahnemann who knew pharmacology as well as Hahnemann. Part of the reason is because it was multifactorial. Hahnemann was a genius, and he spoke 9 or 11 languages, and he had quit medical practice out of disgust heroic medicine to translate textbooks. And people loved Hahnemann's books. They would say, like, he would make corrections. He would, like Cullen's Materia Medica, where he made this cinchona bark commentary in 1790, or he would translate Lavoisier's chemistry text, and Hahnemann would put footnotes with corrections. So people would reference Hahnemann's translation because it was so accurate. And I believe it was Hahnemann's father-in-law was an alchemist. So you have this like genius guy who speaks all these languages, who translated all these medical texts, who also had the experience of working in pharmacy. He understood drug effects in a way that nobody else did. And he was really one of the first to do experiments on single medicines. So most medicines of the day were given in combination, so you couldn't really ascertain the pure effects of the drug, whereas he was very insistent on testing one drug at a time. So in Hahnemann, just if we look at Hahnemann, and you have to recognize that the Pocketbook has 125 remedies, which maybe seems small by modern comparison, but Hahnemann has 95 of those remedies. And now Hahnemann contributed to the provings of many of the other 30, because we see Hahnemann listed in Staff's provings and et cetera, like Sevadilla. And there are a number of provings that came in Staff's archives that Hahnemann contributed to, but he didn't publish them in his own Materia Medica. But just if we include the remedies from Hahnemann, the 95, we have about 66,000 symptoms and over 1 million printed words. Now that's in a time before computers. Just let that sink in, because I don't think I could do that in my lifetime. Hahnemann's entire life was devoted to developing a system of medicine, a very coherent and logical system of medicine, and experiments to apply pharmacology in a very specific way. And he was a master of it. And because of all these different things, his language experience, his pharmacy experience, his medical experience, he had an ability to sift through a lot of white noise and see gold nuggets. When Hahnemann picks out something we'll teach in our conference with looking at these old school toxicology reports, that Hahnemann, he didn't just take information from the old school reports, he distilled them and value added to them. When Hahnemann makes a comment about something, it's extremely accurate. And if you look at, there's like a rubric in the Berningshausen Therapeutic Pocketbook for pneumoconiosis, that's coal miner's disease or the glassblower's disease, where they get silica particles in the lungs. And actually the jeweler who made my wedding band died of that disease. A lot of jewelers get this disease. If you look in that, silica is one of the few remedies, and silica is very prominent. And if you look in modern, you could just do a Google search, silica pneumoconiosis, and you will find that very prominently, silica toxic exposure is one of the main known modern medicine causes of pneumoconiosis. So Hahnemann's observations have stood the test of time. And Berningshausen was Hahnemann's best student. And so all he did was encapsulate the key characteristics into an index for us. But it's really not Berningshausen, it's Hahnemann that we're in love with. It's just that Berningshausen gave us a tool to make Hahnemann easier, if that makes sense. And when I started doing this over a decade ago, I was trained in a very Hahnemannian, but Kentian. And so transitioning and changing my thought to use a different repertory, at the beginning, it was goofy. It was hard, clunky, because I wasn't used to thinking in a slightly different way. And there were many cases, especially developmental delay cases. I'll give you an example that kids would have really bad tantrums and I would give a remedy like tuberculinum. Okay. Now, 10 years later, 12 years later, I almost never give nosodes. Now, maybe that's a bias in my prescribing because I used the therapeutic pocketbook, but I would say that it's because what I've discovered, and I keep honing the experience and getting better and better at it, is that the gems in Hahnemann they're so good that it's better to have less but more valuable information than too much noise. And many cases that I would give tuberculinum before that would fail, I now give remedies like Nux vomica. And you'll see a kid who's maybe constipated and has massive anger outbursts and sensitive to lights, noises, and odors. And I think I said constipated. And they will lights out respond to Nux vomica and have amazing transformations. And in the past, I would prescribe a remedy like tuberculinum because of the tantrums and maybe over psychologizing the tantrums and the way the tantrums looked and whatever, and get an unhappy result. And I think it's that my experience in going back to the sources and back to Hahnemann and back to the original remedies it's in a way freed me to use less remedies, but use them more accurately and to use them in new novel combinations that I'd never used before. Like I may give thuya or lycopodium in a low back pain case and have amazing results because it came up prominently in the therapeutic pocketbook. And yet I probably wouldn't have prescribed it before because I would have been in the Kentian model trying to use a keynote or what have you. Now, one other commentary on this, there's a researcher in Switzerland, Heiner Frey. I don't know if you know him or if you've had him on your show.
Yeah, I haven't had him, but I had Tim. Was it Tim? What's his surname? Anyway,
Tim
yeah.
Miller. No, Tim,
No,
yeah,
not Tim Miller. No, it wasn't Tim Miller. It was
Tim Shannon.
somebody who teaches his work. Shannon? Tim Shannon.
Yeah, Tim Shannon.
Yes.
So for those of you who don't know, this is Heiner Frey's book, okay? And this is what he looks like. He's a really lovely man, a very sweet man. He uses a version of the therapeutic pocketbook, and I wrote an article maybe 10 years ago critiquing his method. And I say that lovingly because I have a great respect for the man. There are certain things that I corrected in the methodology, but people can read my article. But that's how we progress in science, isn't it? It's not having an ego, but working towards more accurate results. But I'll say that the reason I have respect for Heiner Frey, he's a pediatrician who sees 40 patients a day, okay, for probably 40 years. And he gets amazing results in clinical practice. And early on in practice, he was a Kentian, and gradually he transitioned to the Berningshausen therapeutic pocketbook. And he has his own flavor of how he uses the pocketbook called polarity analysis. But one of the things that he did very well is in 2005 in the European Journal of Pediatrics, he published an article on a randomized double-blind placebo-controlled trial of the treatment of ADHD, okay? And what's amazing about that is there have been several other studies of ADHD that were not successful. There was a study, I won't name the authors just because I don't want to sound disparaging, but there was a study that used more of a Sankaran type methodology, and it was placebo controlled, but it didn't work. It wasn't better than placebo. What's amazing about Heiner Frey's study is that it was button tight from a science perspective. Like the outside world, not the homeopathic world, but the outside world could look at that study and try to shoot holes in it, and it's hard. Number one, it was double blinded. Number two, they actually had in the hospital, they had neuropsychologists, not the homeopaths, they had neuropsychologists doing pre and post evaluations. And so when they saw results in this case, and the reason it got published in a conventional journal, the European Journal of Pediatrics, is because it was solid. Okay. And one of the commentaries that I think Heiner Frey has had is that in his experience, very similar to mine, even though I went more of the TBR2, George Dimitriadis pocketbook method, and he has more of the polarity analysis. As he used less remedies, but more accurate data points. So very much focused on the modalities, objective findings, things like that. The accuracy of the results went up and the dramatic results went up. Okay. And I'll give you an example of a case in a little bit, but suffice it to say, one of the things that he noticed is that by using less remedies, but more accurate data points in a more accurate repertory that wasn't as bloated and full of additions with too many additions that kind of distract, he got better and better results to the point that they were able to break the placebo barrier, which, by the way, is really hard in any study. Any research study is very hard for homeopathy to break the placebo barrier, but exceptionally hard in ADHD. ADHD is not an easy condition to treat because the symptoms are like vague, and you know what I'm saying? And he cracked the code and figured out how to do it. One of the really interesting commentaries in his book, but also in his research, is that in the treatment of ADHD, so modern day kids with ADHD, can you guess the 3 most common remedies?
Probably tuberculinum, medorhinum.
No, no. And none of those nosodes are in the therapeutic
No, oh,
pocketbook.
so do you mean what we would prescribe generally or what he would prescribe?
What he would prescribe,
Oh, what he would prescribe, probably Nux
that
vomic.
he found in his study.
Probably Nux vomica would be one of them.
So Nux was up there. Nux was up there. The 3 most common were calcarb, lycopodium, and sulfur. Those 3 remedies accounted for 30 some percent, maybe like 33 or 34% of all the ADHD cases. Now he had, I don't know, 40 or 50 remedies. If I can find the page, I'll show it to you, that they prescribed in their study. So they individualized the cases. And some remedies were like 1%, 2%, that kind of thing. And yet 3 remedies were, here's the page of the book. Can you see that?
Yeah, it's a little bit blurry, but yeah.
Just on this page alone, there's about 40 remedies, okay, that were the most common remedies, 40 of the most common remedies. So you can see they did real homeopathy. It was individualized, but 35% of the cases had statistically significant improvement with neuropsychology testing, with CGI scores, with calcarb, lycopodium, and sulfur. And none of these, all these remedies were in the therapeutic pocketbook. So what that tells you is that the remedies of Hahnemann, the 125 of Hahnemann, are absolutely relevant today. Not only can I say that with a conviction from my clinical practice, but we can say it from hard data from a very modern condition. The ADHD, you see absent-mindedness in the materia medica, but it wasn't a diagnosis in Hahnemann's time. And it's an epidemic now, right? I think like something like 5% of kids are diagnosed with ADHD and on stimulant medications. It's huge. So if he could have that kind of results with less remedies and even more dramatic results, and you compare that to a study that used more remedies and maybe more liberal prescribing tactics like the Sankaran methodology, it tells you that, like, in a way, less is more. If we just go back to our roots, like what was Hahnemann saying? And what were the main remedies? We can do really good work with a lot of patients. Now, maybe not all the patients. Nobody's perfect and nobody helps everyone. And it's not a religion. So there are remedies that are valuable outside of the pocketbook. The pocketbook is just a tool. It's not like the Bible. It's just a tool. It's an index, but it's a very reliable index. So sometimes you'll need remedies from a different index. That's okay. Nobody's saying you can't use it. And nobody's saying you can't use remedies outside the pocketbook. It just so happens that the remedies in the pocketbook work really well. And I'll tell you, because I have a lot of kids that I treat on the autism spectrum, house Iamus is a remedy that I prescribe frequently, and it works wonders. I have a remedy. I have a new child.
And is that not in the pocketbook? Is that not one of the 125
House
remedies?
Iamus is in the
Oh,
pocketbook.
it is.
Yep.
I was going to say I use that a lot as well. I thought Nux
So
vomica would have been higher because I think so much ADHD is due to our lives just being so busy. There's so many toxins in the environment, the food dyes, all that sort of stuff. So I'm surprised that Nux vom isn't higher. I actually, after I
it's
had,
fourth. It's
oh,
fourth.
good,
So
excellent. After I had Tim Shannon on the show, he completely sold me on Hunter Fry's method, and I bought both of his books. Like, homeopathic books are not expensive. I think it's probably about 150, maybe $200 for the 2 books, and I managed to find them here in Australia from the Aurum Project. But they're still sitting there on my shelf unopened because And part of it is after interviewing over 200 homeopaths, learning about all these methods. And I'm a little bit of a crow. I collect all these different books and different methods. And I'm probably a bit ADHD as well, because I'm like, oh, there's something shiny. There's something shiny. So I'm learning all these incredible tools on the podcast. But when I spoke to Tim and now speaking to you, the part that deeply resonates with me is actually that deep desire to go back to basics, because doing homeopathy the way that I'm trying to do it at the moment, which is like doing everything, is overwhelming. And which is why I've started honing a bit more into my intuition. So I'll just sit with a client and I'll intuit which tool I need to draw from to prescribe in this
Uh,
case. So not just the remedy, but also which tool is going to best help this client. But you, for one, I just want to say, Jamie, I can tell that you're an incredible lecturer, because the way that you're speaking is so clear. It makes so much sense. You have completely sold me. I think you must also be a great salesperson, because you completely sold me on Bonninghausen. But there is definitely that desire for me to go back to basics, and lycopodium, calcarb, sulfur, how incredible that you can do such amazing work with that. When ADHD does, it's when I have a case of ADHD, sometimes I can feel overwhelmed, because I'm like, we have amazing remedies that can help, but also our schooling system is so broken, especially when I have mums in here. Our kids go to kindy here at 3.5 years old. They're making a 3.5-year-old boy sit down for 6 hours a day. And so I'm like, I don't know that I can give you anything to help you, because you're trying to make your child do something that's not natural. So homeopathy works with the body, not against it. I don't know how much I
yeah,
can do for you, but we do get good results in clinic helping these people. But the schooling system also is completely broken and definitely needs to be fixed.
sure. And nutrition and everything else, and all the screen time and everything else. Let me give you an example of a case that's really interesting, because it's a new case of mine. This is I've been seeing this boy for 2 months. I think he's about 9 years old. I'm just saying this off the cuff for the podcast, so I don't have all the details in front of me. But he's like high functioning on the spectrum and ADHD, and he also has migraine headaches. Okay, those are some of the main concerns. And he has like a speech delay. He could talk, but he cannot have a back and forth normal conversation. He can't normally socialize. So he speaks in scripted movie lines that he's learned from the movie. And the way he talks is he mimics Jim Carrey from The Mask. So he
Oh,
only talks in this very silly, goofy way in these movie lines, and he wouldn't have a normal back and forth conversation. Okay.
that's actually
And
so
the,
gorgeous. I want to meet him.
yeah. And the other concomitants in the case, so he would get these migraine headaches very much from weather changes, like barometric weather changes. And he also would get motion sickness, like nausea riding in a car. And the case, if you looked at the case as a whole, it almost looks like an opium case. But when you take into account the modalities on the migraines and the nausea and the motion sickness, Nux machata was like the main remedy, and it came up beautifully in the therapeutic pocketbook. And if you read in Nux machata, it has this silly goofiness, it has the unawareness, the like abstraction. In fact, in Allen's encyclopedia, there's a symptom that compares the reaction of Nux machata to opium, a very similar intoxicated, drunken state. They have trouble with writing and reading and those kind of things, and the headaches can be worse from barometric changes. This young boy aggravated initially to the Nux machata, got a migraine, and was acting like bonkers for the first couple of days. So we spaced out the doses. The first month, I gave him a dose twice a week, and the aggravations went away. And by the end of the first month, he was talking normally. No silly talking, no scripting. He was actually having normal conversations. He was no longer having migraine headaches, no longer nauseous in the car. He was reading. He never shown an interest in reading in his life. He's just sitting down on summer vacation reading books. And he never showed any interest in playing board games with his siblings. He has several siblings. And now all of a sudden he's like very into playing board games and can talk to them, can have a conversation. He's not acting silly. And the dad was shocked. He's this normal for homeopathy. And the beautiful thing is, yes, if you get the right remedy, it's like magical what happens. And my point being that those remedies, Nux machata is a very nice remedy. It was not one of Hahnemann's remedies, but it was one of the early remedies that's in the pocketbook. Just such a beautiful reaction. So yes, the Pocketbook and the remedies in the Pocketbook and the remedies of Hahnemann are as relevant now as they were 200 years ago. Our physiology has not changed that much. Our genetics have not changed that much. Those remedies that Hahnemann knew the remedies that had the biggest effects on physiology because of his vast knowledge of the literature. And those remedies are gold. In my opinion, less is more. And I think so much in homeopathy is like searching after what's shiny and what's sexy and what's new. And my hope with this conference is that we can have a renaissance of the old. And maybe if we sell it good, I don't consider myself a salesman, but if I could be a really good salesman, maybe we could make those old dusty books sexy and shiny and new, and dust them off and really have this revival of the old literature. Because I think when people really dig into the old literature, they understand Hahnemann's intent more, and they understand the method better, and then the prescriptions get more accurate and the results more dramatic. And then ultimately, aphorism 1 of the organon, the most important thing is to help heal people. And that's the proof in the pudding. When people get better, that's all that matters. That's why we're doing this.
I really like what you're saying. And actually, when you were just talking about that case, recently I've been digging a little bit more into mold toxicity, into mast cell activation, histamine release, all that sort of stuff, just because the cases that we see in clinic are so complicated. Kids have been so over vaccinated, over medicated, C-section births, formula fed, eating junk food. And so in my mind, I have fallen into this trap of thinking maybe our remedies are not enough. Maybe we need more. And so I've started doing a bit more like detox therapy and using histamine as a remedy quite often, because motion sickness is actually due to a histamine overload. It's one of the reasons for that. And also when you were saying about the migraines, I can't help but think maybe there's some mold exposure there that's causing mast cell activation, that's causing the excess histamine, which might be why he's got the migraines and the motion sickness and all these sorts of things. So it's really easy to get carried away with that side of things and go more into a biomedical side, because you do then, if you use supplements like quercetin or even quercetin in low potency or things like that, you can get it down. But then you come and tell this amazing story of what you've just described and then giving Nux muscata, and you're getting such great results without addressing the mast cell activation or the mold or the anything else, or doing detox therapy. And that really is so beautiful to just be reminded of the basics.
Yeah, and I'll tell you a couple of stories. I was just looking in the repertory because I have 2 screens open, and there are 26 remedies in the aggravation riding in a car carriage, so motion sickness remedies. Sulfur is bold. I have a case right now of a woman who, after COVID, she got horribly sick with mast cell activation. Okay. The first remedy she needed was calicarbonicum. Calicarbonicum really shifted the case and moved a lot positively in the case. And then after that, there was like a shifting of the physiology and the remainder of the symptoms of the mast cell activation. Now, she knew there was mast cell activation. In fact, the only thing until we got a good remedy for her that helped was taking antihistamine drugs. Like she would take allergy medicine because it's the only thing that calmed down these post-COVID symptoms.
So not even histamine and potency.
No, she was taking like Zyrtec or Benadryl, and sulfur took her home. So calicarb started the case with a lot of the cough and a lot of the immediate symptoms. That this was like 6 weeks after COVID. She was still very sick and hardly working and not at her full capacity. And then that did some good work for a few weeks, and then the symptoms changed a little bit, and then sulfur took her home. And how often do we see in the old literature sulfur needed at the end of a convalescent case? And yet the applicability to what we now call mast cell activation syndrome, which is this modern newfangled word, and yet those symptoms are all there in Hahnemann, right? I have another great case I just saw yesterday. This is a young woman, I think she's 20. She's like moderate to severely on the autism spectrum. And I have her on Moscas 6C. And she would put holes in the wall and have these big upsets, and she would have these imaginary, almost like insane arguments with imaginary characters from these YouTube videos that she would watch. And she would get in arguments, put holes in the wall in the house, like an insane person, right? And she also had body odor like musk. If you look in 2 symptoms in the therapeutic pocketbook, hysterical convulsions, which is It's not like a seizure. What that means is it's a hysterical spasm, like an uncontrolled spasm, and perspiration, like the odor of musk. You'll see that muskus is like the main remedy. And the father was telling me yesterday, and he was lamenting because his life is hard. He's got 3 or 4 children, 2 with severe autism. The one of them's my patient, and his wife apparently also has bipolar disorder that's unmedicated, and so he often has a really hard time corralling her. So he has to keep the whole ship afloat and the wife, when she doesn't take her medicine, is very hard to deal with. And he was telling me, he's like, she's 20 years old. He said, sometimes she gives me advice now. He says, the
Oh,
weirdest thing, he said, she's no longer putting holes in the wall. She talks. He said, she talks like a normal person. She's not totally like a totally like neurotypical 20-year-old. She's having rational conversation now. And she gives her mother advice. She gives me advice. And sometimes I sit and look and think, oh, she's right. And then he said she's gotten really into writing, and she's really into these like fantasy novels, and she wants to publish these fantasy novels. And so she's telling her dad, can you help me so I can write and publish my fantasy novels? This is stuff that a year ago was not possible in this girl's world, because she was having like insane arguments with imaginary characters and putting holes in the wall. And
wow.
something so simple and elegant, a remedy that I don't think I give often enough because it's such a small remedy, Moscas, was one of Hahnemann's remedies.
Mm.
And it's such a beautiful reaction. So we can't forget the old. We have to remember that's where the gold is in the old.
I always get Nux muscata and Moschus mixed up, but Moschus is the deer musk and Nux muscata is nutmeg, right?
Correct.
Yeah, okay, good. I don't know why I get those two mixed up. Oh, Jamie, holy moly, you have just delivered value bomb after value bomb today. And I am so excited for this conference. So excited. It would have been amazing to be there in person, but I'll definitely join you online for sure. For our listeners, you can go to homeopathyyusa.org, right?
Yep.
Okay, and you'll have all the details of the conference there. There's still an early bird going until the August 27th by the looks of it. The date of the
Correct.
conference is September 20 to September 22 at Sonoran University in Tempe, Arizona. Anything else that we need to tell our listeners about if they want to sign up or what they can expect or any other truth bombs you want to drop?
Well, it's going to be an amazing conference like you've never seen before. And so I highly recommend, if you're serious about homeopathy and you want to see genuine homeopathy by the book, the old fashioned way, and with really good results, this is the conference for you. The conference webpage on the homeopathyusa.org website has lots of valuable information. So first of all, it has all the information about the location, the time, the price. There's a free lecture on there that I gave about ipecac toxicology. That's like a free whet your appetite lecture for the conference. There's information about Sonoran University if you want to come in person. It has all the information for the hotels and the flights, etc. We have thank yous to all our sponsors, which we're very grateful for all our sponsors who help us make this possible, help us pay to put on an expensive event like this. And there's the schedule on there, so you can actually see the titles, the speakers, the titles of all the events. And if you come in person, we're going to have a fun time. There will be social events on Saturday night. There will be a screening, a private screening of the movie Introducing Homeopathy, which I don't know if you've heard about this, with
Yes,
Kim
I've had
Malia.
Kim on the podcast twice. Yeah, I saw that on your schedule. I love that you've got this conference schedule there, and I saw that you've got the private screening on the Saturday night.
So
That's going to be amazing.
yeah, so it's going to be a fun social event, and then the movie screening, and they're in talks with Netflix right now. So this could be huge for homeopathy. In terms of the speakers, oh, let me say, so I gave this free lecture. That free lecture is available on the website, so you can actually get a taste of what the conference will be like. George Dimitriadis, who's coming all the way from Australia, he will be here in person. A great chance to meet him if you want to. He is going to give a free lecture on, let me just make sure I got this correct.
I saw in our Homeopathy Hangout podcast Facebook group, I saw that you posted in there about the lecture with George coming up in the next little while.
Yeah, so it'll be August 19th in the afternoon in the US and August 20th in the morning in Australia. And so our speakers, so that'll be a free lecture, and that's the week before the early bird discount ends. So if you want to get one more taste of what the conference will be like and the quality, you will not find a scholar. It's hard to find a scholar of George Demetriadis' caliber. I'll just say that there's very few homeopathic scholars alive of his caliber, and the chance to see him speak and meet him is great. If you want to go online, you'll still get all the same content and the value. I just think it'll be fun to come in person. In terms of the speakers, George Demetriadis is speaking. I will be speaking, as well as a colleague of mine, Dr. Nazanin Vasigi. She is the chair of homeopathic medicine at Bastyr University in San Diego, California. And she was the graduate of our residency program 2 years after me.
Aw.
And both of us have done a teacher training program on the TBR2 Berninghaus Therapeutic Pocketbook method with George Demetriadis. And the two of us, our lectures are going to be complementary to each other, and they're going to be focused on Hahnemann's Materia Medica and an introduction to Hahnemann's Materia Medica. And basically, we want people to walk away less intimidated and introduce you to feel comfortable with Hahnemann, and also with the toxicologic sources that he cites that we will then reference in the library that I spoke about that's housed at Sonoran University. And with our real hope that this library there's a renaissance to this literature and people just use it now that it's an open source. We have Denise Strages speaking. She is Denise Strages.
Yeah, she's
And
gorgeous. Yeah.
she's
Such a vivacious lecturer and just, yeah, beautiful speaker and so knowledgeable.
yeah, she's like somebody that you have to hold on to your seat while you listen to, because she's from New York and she's Italian and really a fascinating speaker. She's going to be giving a history talk. She just finished a master's degree at Johns Hopkins University on homeopathic history, and how she figured out how to get Hopkins to approve a thesis on homeopathy, I have no idea. She worked amazing magic and a lot of hard work. And her talk will be a blend of that research, and she's going to go through like the decades following Hahnemann's death in 1843 on the bacteriological revolution that ushered in what she calls biomedical modernity, and how that infiltrated medicine, including homeopathy, and the introduction to from nosodes with Herring, and how that was influenced by this shift in medicine, and take that along the course of history, and then show how that kind of caused a little bit of divergence in homeopathy from Hahnemann in terms of philosophy. So it'll be a really fascinating historical talk. So I talked about George. So George Demetriadis is speaking Saturday morning US time. And his presentation, there's going to be 3 parts. First is going to be about Materia Medica, what he calls pharmacography, pharma meaning the drug, and the writing of the Materia Medica. And he is going to teach us an overview of the Materia Medica and then go into the repertory. And then he's going to really give us the nuts and bolts of the Berninghaus Therapeutic Pocketbook. I have actually taught a course for Kim Aaliyah on Whole Health Now about how to do the TBR2 Therapeutic Pocketbook, how to use it. But he is the world expert. So at this conference, we want people to hear from him. So this is people's chance to hear from him. And then he's going to do a bunch of cases with applying TBR2. And in the free lecture he's giving on August 19th here in the US, August 20th in Australia, it's going to be a stroke case where he follows the sequence of 5 remedies, 1 wrong prescription, but the rest correct prescriptions, and this patient's response and recovery after a stroke. So it'll be an amazing lecture.
Lots, very timely as well. There's lots of those these days. So,
absolutely, with cardiovascular
yeah,
disease.
great.
And then we just have a couple more talks. Kathleen Sloniger is a nurse and a homeopath, and she's going to be giving a lecture on 6th edition posology, which a lot of people ask questions about posology, so that's always relevant. And then one of the talks that I'm most excited about is this talk by a friend and colleague, Juan Carlos Gamba, who's a medical doctor in Bogota, Colombia. And he's giving a talk called The Homeopathic Neural Regeneration and Recovery, Linking Neurologic Cases with Hahnemann's Toxicologic Sources. And he's going to present 3 complex cases with a really severe pathology. I don't want to give away the farm, so I'm not going to tell you the remedies or anything else, but you will be blown away. One of these cases is a case of cerebellar ataxia with cerebellar atrophy. So the cerebellum was atrophied, it shrunk, and he treated with it reversed with homeopathic treatment. He has pre and post video of the patient, and he has pre and post MRI. So you see that this never happens in medicine, that the cerebellum actually regrew, it regenerated.
Wow.
And he has the evidence to present it, and a very beautiful, elegant prescription with a remedy that all of you know from Hahnemann that's in the therapeutic pocketbook. And you're going to see it and you're going to, wow, that's
So,
amazing
so
what
no
homeopathy.
cerebellum endocrine sarcodes or anything like that,
No,
which is what
just
I'd
a
be looking at.
beautiful, a beautiful remedy from Hahnemann. And then
Wow.
he's gonna give a stroke recovery case and a case of metabolic encephalopathy that he rescued from near death. I think it was like almost a near death case that recovered with homeopathic treatment. So that's gonna be really amazing. And on Sunday morning, there's going to be a talk by Wendy Jensen. Wendy Jensen is a veterinarian. And this is really cool because personally, I feel like there's a lot to learn from animals. Bernninghausen actually treated successfully many animals in his practice, but nowadays we have veterinarians that do the work and do homeopathy. And Wendy was a co-author of the modern homeopathic veterinary repertory with Richard Pitcairn. I apologize, I don't know the exact name of the repertory. So she has been teaching and as a scholar in the veterinary homeopathic world in America for many years. And I didn't even know it, but she saw a lecture of mine about 7 years ago and realized the errors in her own repertory and began being a TBR2 veterinarian and
Wow.
using the Bernninghausen therapeutic pocketbook. And she now almost exclusively uses that repertory and is getting amazing results with animals. And she's going to be presenting. And so that will be an exciting presentation. And then lastly, their active skills workshop where we're going to actually practice the skills, do practice cases, etc. So amazing conference. If you want to take your skills to the next level and help heal people, this is going to be the conference for you.
You have completely sold me, Jamie. I cannot wait. And I really love the workshop at the end there as well to put that new knowledge into practice straight away. So love it. So just for our listeners again, do you want to give them the URL of where they can go find out more information?
Yeah, so the URL is homeopathyusa.org/2024-collaborative-conference.
Okay.
It's a long name, but if you go to homeopathyusa.org on the homepage, there will be a redirect to the conference. So
Wonderful. And we'll put
go
it
to
in the show notes.
homeopathyusa.org.
Excellent. Thank you so much, Jamie. I really appreciate your time today.
Oh, you're welcome. Thank you so much for having me on.